stage, she's supposed to be attended to. She cannot be left alone. And when a woman is left in second stage, then that means that woman is not safe. She will either get what is called FFF or RVF, or she will lose her child because the child will fall down as a result of coming out without being assisted. So, and that woman might bleed to death. So what I intend to do, inshallah, if God helps me to go through this process that I'm going through, then I will make sure that those processes of the outreach programs come back. And then the women, because Somalis are people who never take people to account. If a nurse conducts your wife and that child dies, then Somalis say it's God's case, and they never take the nurses to account. I will take that responsibility of taking that nurse who has conducted that child, who has died in her hands, to be taken to account, and she has to be answerable, because that is professional negligence.
Good, okay. Well done. Well done. Let's go on.
Thank you very much. My name is Ibrahim Ismail Hassan, a youth leader from Garissa. I would like to ask 2 questions. The first one is back to the hospitals. It has come to the concern of the community that in Garissa General Hospital, if a lady is taken to that hospital, she stays for less than 30 minutes, and the doctors will take her for a CC. What is happening? It's cesarean. What is happening in our hospital? And is there any plan? Is there any Marshall Plan? Is it because of the number of doctors we have in our hospital, or it's because of frustration, because they are overwhelmed with the job? My second concern is about employment. I want to tell the governor and all the other people who are contesting and seated in front of us here that more than 80% of lack of opportunity is not actual lack of opportunity, but it is negative attitude to opportunities available in Garissa. And with that, I want to quote a research by Garissa Youth Project that was done in 2008 that said that every day 5,000 people who are not Somalis flock to Garissa town. And at the end of the day, each one of them earns 500 shillings. With simple calculation, how much is that money? How much is that money? Simple calculation. That is 2.5 million per day. Goes to people's hands. It is the jobs they do that our young people like me and my friends, feel we don't want to do. We feel so proud that we don't want to do that. And we can't be that low to dig a hole, to cut a madenga tree, to fence somewhere, to become a mason, to become a carpenter, or do any other job that will have empowered all these young people who are standing without a job. My question is, as leaders, what will you do to influence the negative attitude of young people towards the employment opportunities available for them in Garissa? Thank you.
Ali Korane, let's start with you.
Good, thank you very much. I think if I may start with the hospital, and to carry on from where we left about child mortality, I think the biggest challenge is access to quality health. Whether it's child mortality, whether it is the doctors not attending to patients, all this is, I think, access to quality health. As part of my plan, I intended to increase that access to health. Because now the Garissa Provincial General Hospital is a provincial referral hospital for the entire northeastern province, the previous northeastern province, and the neighborhoods, Tana River, Lamu, and wherever people come from. And that pressure on that hospital can make even the workers mad. In order to take that pressure away, as part of my plan, I intend to have district hospitals in all the 7 districts of this county. That is in Dadaab, Modogashe, Balambala, Garissa, Burra, Masalani, and Hulugo. And once we have well-equipped, human resource health facilities at the district, and then we increase access to health centers and dispensaries, and then we upgrade the facilities in the hospital, I think some of our problems will be problems of the past.
Captain Mohammed, let me jump to you. Let him answer part of that. Captain, go.
Jeff, perhaps maybe I really concur with what Ali Korane has said in terms of the medical facilities. Perhaps maybe it is as a result of adequate facilities to cater for the needs of these people. Well,
what about what he talked about, the jobs that they won't take?
I'm coming to that. The fear of soiling their hands, that is a serious issue. We don't want a situation where our youth are selective. And I want to make it here and clear that we cannot all be employed in the mainstream government jobs. They are not there. Let nobody tell you if he or she is elected, they will all employ you. Forget about that. And if you youth are like you don't want to sell your hands, then you will be kind of hanging around like you are doing now. And those whom you are saying are crossing the bridge coming to this side making 500 shillings per day will continue making this money. How do we approach this? I want to approach it by having to change your hearts and minds. Starting now, I want to start that battle and give you hope, a ray of hope. The youth forms the backbone of our human resource in this area, Jeff. The economy, the backbone economy of this county and this region of this town is the livestock industry, Jeff. Nobody has taken the trouble to address seriously and review this sector.
Is it
You
true
will
they have the
realize-
largest market here in
I'm
Garissa?
coming to that, Jeff.
But is it true it's the largest in East
In
Africa?
Africa,
East and Central.
East and Central Africa,
So the
perhaps
meat we eat in Nairobi comes from Garissa?
Yes.
70% of the meat you eat in Kenya comes from this place every Wednesday. It's the market day. Jeff, this is a multi-million-dollar sector. And history has it, during the colonial time, before we got our independence, the white man had addressed and seriously considered this sector as very potential, in the sense that we used to have livestock marketing departments, quarantine areas in Isiolo, Wajir, and Mandera, grazing pattern areas that were designated to sustain this sector. Successive governments have failed to address and improve this, Jeff. Today, we have a Ministry of Livestock, powerful minister, with big budget. We have a commission by the name Kenya Meat Commission. Jeff, believe me you, if this sector is addressed and the Marshall plans are put in place, we are able to sustain our economy as a county and generate enough revenue without even asking for a government budget. And all the youth will benefit from this directly or indirectly.
Okay, good. Okay. Question?
Thank you, Jeff. First, welcome. I'm not intending to ask a question. I'm Isaiah Rokain, an aspirant for Balambala constituency. The few things that I wanted to share is, as Mr. Korane said, our community needs